Tell me how I'm supposed to breathe with no air.
We're the bronchodilators, and we're going to teach you about asthma.
Are you okay?
Yeah, my chest is tightening. I can't breathe. I'm like wheezing.
Do you have asthma?
Yeah.
Oh no, do you have albuterol?
Yeah.
Let me get it.
Oh, thank you so much. Oh, thank God.
Alrighty, let's talk asthma. So here we have some nursing diagnoses for a patient with asthma. Our first one is ineffective airway clearance related to bronchospasms, excessive mucus production, tenacious secretions, and fatigue. Next, we have anxiety related to difficulty breathing, perceived or actual loss of control, and fear of suffocation. And lastly, we have deficient knowledge related to lack of information and education about asthma and its treatment. Asthma attacks can range from mild to severe, depending on the patient. The most common clinical manifestations for an individual suffering from asthma includes a cough, shortness of breath or dyspnea, wheezing, tightness in the chest, and variable airflow obstruction. If you are having any one or more of these symptoms, it is an indication that you are currently experiencing an asthma attack. Symptoms usually occur slowly over time, but when triggers are added together at the right time, a sudden attack may take place. For an individual with asthma, it is common to have a cough in the early morning or at night before bed. Having nocturnal awakenings due to cough, wheezing, or shortness of breath is an indicator that your asthma is severe. It is also seen to occur during exercise or even by just laughing too hard. An asthma attack is a result of a trigger, whether that is from an allergy or a pollutant in the air. Other examples of triggers are animal dander, pollen, cigarette smoke, aerosol spray, viral upper respiratory tract infection, drugs like aspirin or NSAIDs, laundry detergents, industrial chemicals and plastics, beer, wine, dried fruit, shrimp, processed potatoes, GERD, and even stress and hormones. As the severity increases, symptoms can interfere with a patient's ADLs. There are two main types of medications for asthma: anti-inflammatory drugs and bronchodilators. For anti-inflammatory drugs, we have corticosteroids, which come in an inhaled form like fluticasone or Flonase, and in oral form, prednisone. There are also leukotriene modifiers, montelukast or Singulair, and anti-IgEs like omalizumab or Xolair. With bronchodilators, we have long-acting beta-2 adrenergic agonists and short-acting beta-2 adrenergic agonists like albuterol and salmeterol. We also have methylxanthines like theophylline and anticholinergics like ipratropium or Atrovent. Many of the drugs for asthma are administered through inhalation devices due to a faster onset of action and a decrease in side effects. Inhalation devices include metered dose inhalers, dry powder inhalers, and nebulizers. Though asthma is commonly underdiagnosed, there are a few tests that can be run to properly treat this patient. First of all, it is best to establish a history and physical examination. There are also pulmonary function tests which determine the reversibility of bronchoconstriction, thus diagnosing the individual with asthma. There is also the peak expiratory flow, which measures how fast you can blow air out using the maximum effort. Also, there is, of course, the allergy testing, which determines what triggers you may have and if you need to stay away from cats or certain foods. When first diagnosed with asthma, it is important to put together an asthma action plan with your nurse or provider. This will prevent an unwanted situation and will prepare you to deal with your new diagnosis. There are 3 different zones when it comes to asthma. The green zone is for when you are breathing well, there is no coughing or wheezing going on, you are able to sleep through the night, and you are able to work and play. Take the medications prescribed. You are not in any current danger, but it is important to be aware of any changing symptoms. The yellow zone is when you may notice the first signs of a cold. You have had an exposure to a known trigger, you are coughing or wheezing, or your chest is tight. This is when you should contact your provider and let them know what is going on so you can avoid the red zone. The red zone is the danger zone. This is when your at-home medicine is not helping. You have no control over your breathing and you cannot speak. This is when you call 911 and go straight to the ER. Do not wait.
So asthma, the cascade will be triggered by a said allergen, pollutants, certain drugs, viral infection, even exercise. Basically, asthma starts by, it triggers the mast cells, which are linked to the immune Ig antibodies. These are linked together. The mast cells are going to start to degranulate. This then releases inflammatory mediators, histamine, prostaglandins, leukotrienes, and cytokines. The release of these inflammatory mediators are going to cause thickening airway walls, congestion, edema, production of thick mucus, bronchial muscle spasm, which can become hyper-responsive to that muscle spasm, and airway obstruction, which is going to cause that cough that you hear in asthma patients. If the patient has long-term for chronic inflammation, can result in airway remodeling.
Control?
Yeah. So sometimes I wheeze.
Ever wake up short of breath?
I do.
Use your fast-acting inhaler more than twice a week.
I use mine every day.
If that's what you call control, ask your doctor if prescription Flovent is right for you. Flovent twice a day helps control the inflammation that can cause asthma symptoms in the first place and helps improve lung function. Flovent won't replace fast-acting inhalers for sudden attacks. People switching from an oral steroid like prednisone to Flovent, an inhaled steroid, need to be especially careful. While adjusting to the switch, your body is not as able to heal after surgery, infection, or serious injury. See your doctor if your asthma does not improve.
Now this is control.
Call 1-800-426-7929 today for a rebate and a free asthma workbook so you and your doctor can determine if your asthma is really under control. That's 1-800-426-7929. Flovent, helping you to find asthma control.
All right, you can have a seat right over here.
Perfect.
All right, so what were you doing today?
I think I have asthma.
Okay, can you tell me a little bit about what happens when, like,
So every now and then I get really short of breath and I have wheezing, and I notice it's a lot of times around cats and when I'm exercising, and sometimes it's hard to control, so I'm looking for help.
okay, I'm just gonna take a quick listen to you real quick.
Okay.
How do you move forward? Yeah, I'm definitely hearing some wheezing. Are you currently taking anything when that happens to you?
No.
Or no?
I don't have anything.
Okay, and then do you have any family health history of asthma?
My mom has asthma.
Your mom? Okay. I'm gonna step out. The doctor will be in to see you in just a minute, and I'll be back after that, okay?
Perfect, thank you.
You're welcome.
Hi, Ashton.
Hi.
I am Dr. Lemus.
Perfect.
How are you today?
Good, how are you?
Great. The nurse says you think you have asthma?
Yep.
All right. You have asthma.
Good.
Here's some albuterol and corticosteroid.
Perfect,
All right,
thank
the
you.
nurse will be right back in with you to teach you about it.
Thank you.
All right. So sounds like the doctor says he has asthma. He also said that he gave you corticosteroid and an inhaler with albuterol. So you said that mostly it happens when you're around cats or exercising. So I was thinking maybe we should do some allergy testing to see if there's
Okay.
anything else that you have triggers, so you can learn those and avoid them.
Great.
Okay, and then if you ever do get anything that you feel is like an upper respiratory infection, make sure you come in and get that treated right away.
Okay.
And then we're just really gonna work at minimizing your symptoms and the severity of it, okay?
Okay.
So do you feel confident that you can maintain this over a long time?
Yes, I do.
Yeah, you do. Okay.
Yes.
So
And I was given all the right tools.
you were. Okay,
Yes.
so we've got the pursed lip breathing down. They
Mhm.
taught you about the peak flow meter.
Yes.
You know how to use your inhaler.
Yes.
Okay.
All right.
You want to teach some of that back to me?
Yes, definitely. So this is the inhaler, and this was my albuterol. So I know when I start to have an asthma attack, I need to shake it very well and push and breathe in tightly. And I can do it up to 3 times in 20 minutes or until my symptoms subside.
Awesome.
And then I also know to help with that to use pursed lip breathing, which you breathe very slowly, just like that. And then there's also the peak flow meter, and I know there's different levels, and there's a good level, an intermediate level, and a red level. And in the good level, it's green. You don't really need to do much, just make sure that you get it under control. The intermediate one is when I use my albuterol and I watch for any worsening symptoms, and then the red is when I seek immediate emergent attention.
Very good.
Thank you.
Is there any other questions I can answer for you today?
Nope, that's it.
All right. See you later.
Here's some facts about asthma. 8.4% of people have asthma in the US.
Women are 62% more likely to get asthma than men.
Puerto Ricans and African Americans are the most affected by asthma.
More than 3,300 people die from asthma each year.
Asthma counts for 1 in every 200 deaths around the world.
2 million people in the world are affected with asthma.
Asthma can become a chronic condition.
More than 14.2 million lost work days are from adults with asthma.
GERD is more common in people with asthma.
Don't let life be a wheeze. Talk to your nurse today so life can be a breeze.
Tell me how I'm supposed to breathe with no air.